everyone, in this video we will be seeing foot dorsiflexion and inversion. Muscle responsible is tibialis anterior. Patient position, short sitting. Therapist position, sitting on the stool in front of the patient with patient's heel resting on the thigh. Stabilization is provided over the posterior leg just above the malleoli. For the grade 5 and 4, resistance is provided over the dorsomedial aspect of the foot. Test: patient dorsiflexes ankle and invert foot keeping toes relaxed. Instruction given to the patient: bring your foot up and in, hold it, don't let me push it down. Grade 3, patient completes available range of motion without resistance against the gravity. Grade 4, patient completes available range of motion with moderate amount of resistance. Grade 5, patient completes full range of motion against maximum amount of resistance. Grade 2, patient completes partial range of motion. Grade 1, palpate the tendon of tibialis anterior on the anteromedial aspect of the ankle at above the level of malleoli. Belly of the tibialis anterior is palpated just lateral to the shin. Grade 0, no palpable contraction. Foot inversion. Muscle responsible is tibialis posterior. Patient position, short sitting with ankle slight in plantar flexion. Therapist position, sitting on low stool in front of the patient or on the side of the test limb. One hand is used to stabilize the ankle just above the malleoli. Another hand provides resistance over the dorsum and the medial side of the foot at the level of the metatarsal head. Resistance is directed towards the eversion and slight dorsiflexion. Test: patient inverts foot through available range of motion. Instruction given to the patient: therapist may need to demonstrate the motion. Turn your foot down and in, hold it. Grade 3, the patient will be able to invert the foot through full range of motion without resistance against the gravity. Grade 4, patient completes available range of motion with moderate amount of resistance. Grade 5, patient completes available range of motion with maximum amount of resistance. Grade 2, patient completes partial range of motion. Grade 1, palpate the tendon of tibialis posterior between the medial malleolus and the navicular bone. Alternatively, palpate the tendon above the malleolus. Grade 0, no palpable contraction. Foot eversion with plantar flexion. Muscle responsible is peroneus longus and brevis. Patient position, short sitting with ankle in neutral position. Therapist position, sitting on low stool in front of the patient. Stabilization is provided just above the malleoli. Resistance is provided over the dorsum and the lateral border of the forefoot. Resistance is directed towards inversion and slight dorsiflexion. Instruction given to the patient: turn your foot down and out, hold it, don't let me move it in. Grade 3, patient completes available range of motion without resistance against the gravity. Grade 4, patient completes available range of motion with moderate amount of resistance. Grade 5, patient completes available range of motion with maximum amount of resistance. Grade 2, patient is able to perform partial range of motion. Grade 1, to palpate the peroneus longus, place the fingers on the lateral leg over the upper 1/3 just below the head of the fibula. The tendon of the muscle can be felt posterior to the lateral malleolus but behind the tendon of the peroneus brevis. To palpate the tendon of peroneus brevis, place the index finger over the base of the fifth metatarsal. The belly of the peroneus brevis can be palpated on the lateral surface of the distal leg over the fibula. Grade 0, no palpable contractile activity.